Hello, my name is Dr. Carlo Renato. I'm a chiropractor from Sydney, Australia. And with my colleague and friend, Dr. Ulrich Sandstrom, we'll be heading towards London, October 6-7 to present our integrative protocols for the cervicogenic patient. We recently presented in Oslo, Norway, where we had fantastic feedback, not only on the content, but also on the banter that Ulrich and I brought to the seminar as well. It was a great pleasure to share the stage with Ulrich. Whilst we come from different approaches, one from a functional orthopedic, myself from a functional neurological approach, we had so many commonalities that the group and the attendees thoroughly enjoyed. So this particular seminar is all about upskilling the practitioner, whether they're physio, chiro, osteo or otherwise, in how to better assess, manage and understand so we can communicate better cervicogenic problems. And these include whiplash, concussion, cervicogenic joint dysfunction, chronic neck pain, and other related symptoms and conditions, with an approach that is both contemporary and very translatable and applicable to office. So Ulrich has been around the trap for years. Most of you would know of him as an experienced lecturer, clinician, and treating physician for many sporting teams, including at the Olympics. Myself, I wear many hats, from a clinician I'm the clinical director of a concussion and vestibular rehab practice. I also teach within Australia and overseas, as well as doing a PhD in vestibular rehabilitation. So I wear various hats that keep me occupied, no doubt. Ulrich and I last year decided that our skills can join forces, and certainly we look forward to passing this information on to many practitioners within Europe and hopefully in time across other parts of the world as well. So collectively we bring a lot of experience, but ultimately what we want to do is make sure that the information that we know and use in practice, as well as learn from our experience and from research, can be easily translatable to practitioners, so they not only have this wealth of knowledge, but more importantly, they can translate that information to be better clinicians and have better clinical outcomes for their patients. And more than anything else, I think something that we achieved in Norway, and we certainly will achieve in London as well, is that we want the attendee, you yourself, to be able to walk away with, what is it that I'm looking for? How is it that I can identify this in my patients? How is it that I can communicate this in the effective way? And then how is it that I can better manage these patients? And we spend so much time going through the assessment as well as management, and we finish off with an integration perspective, whereby Ulrich and I sit down together, or in fact stand up on stage, and go through some clinical cases and answer some questions from you guys. So you're in for a treat. Day one, as mentioned, Ulrich will go through many of the orthopedic aspects, from manual muscle testing in a very functional aspect, instrument-assisted techniques, taping, which he does fantastically. So, I think Ulrich and I both believe the premise that we treat the person, not the condition. And we'll use various aspects that we can peer into or look into what the patient is presenting with, and treat them as they are. So it's very much an N=1, or a very tailored approach to helping patients. We'll give you the bigger picture, we'll give you how to do things, but ultimately there's no one-size-fits-all protocol, and we'll go through how we can best evaluate and apply that to your patient. So some of the content that whilst I have the opportunity, I'll go through some of the content that I'm going to be covering. And whilst I'll cover some of the first principles, which are some of the neuroscience behind the cervical spine as it relates to the brain, and how the brain relates to the cervical spine. Ulrich does a great job at looking at a bottom-up or a neck-up approach. I'm going to tackle it from a brain or a top-down approach. But for that to happen, we need to understand some of the connections between the brain and the cervical spine and some of the other areas as well. And we won't spend a lot of time on it, but I need to preface that because without an understanding of these connections, we're not going to understand why is it that we're looking at the eyes? Why is it we're looking at the vestibular system? Why is it we're looking at the balance system to better evaluate and understand as well as manage patients with cervical spine? So we'll go through some of these aspects and I'll cite some papers so you guys can have references for that as well. And then obviously we'll talk about what happens when the cervical spine has a problem, whether it be through a whiplash, a concussion, poor posture, or anything else like that. So what happens to the cervical spine? How is it the cervical spine dysfunction in that influences the brain? How is it that it influences eye movement? So why is it that we see people with neck dysfunction have blurred vision? Why is it that they may experience dizziness? Why is it that they may experience poor balance? And we need to understand through a first principles approach why this occurs, and we'll certainly dive into that. Following that, we'll then try to bring everyone into a more contemporary sphere when it comes to looking at and managing people with cervicogenic problems. So we'll look at proprioception and joint position, which is a fantastic topic we'll expand on heavily. We'll look at oculomotor. We'll look at what tests can we use to look at eye movements that can give us an insight to what's happening with the neck. We'll look at balance and various aspects of balance test, and we'll look at vestibular function and testing, which is, I guess, a pet of mine as well. So with the cervicogenic dysfunction, we're going to focus heavily on proprioception. I'll bring various lasers and wall charts that we had a great response from not only the Oslo group, but everywhere where I've presented this material, both in Asia, Australia, have really enjoyed this aspect that we can quantitate and qualitate cervical joint dysfunction by using a great little tool, and then we can then turn that into a management that can be a great adjunct to what we do as practitioners, whether it be through manual therapy or soft tissue therapy. We'll also look at the influence that the cervical spine and brain has on balance and posture. And as practitioners, manual practitioners, and as chiropractors, excuse me, we look at posture, we look at spinal dysfunction, we look at various aspects of balance and joint dysfunction, and we're going to look at it. We're going to look at it as well from a vestibulospinal component. We're also going to look at a vestibular ocular component. Why is it that the eyes and the inner ear? How is it they relate to the cervical spine? And we'll talk about that. Finally, we'll look at the common ground between concussion and whiplash, and how much of the research that's coming out now is looking at the differences between whiplash and concussion cannot be distinguished by symptoms alone, but through various tests. And we can identify, in fact, all of these tests that research now is saying this is what you should be doing. So you guys are going to be so much ahead of the game as it comes to not just managing people with cervical joint problems, but also looking at concussion-related issues as well. And as mentioned, it's almost indistinguishable between a cervical spine injury through a whiplash and a concussion. You cannot discern the two by symptoms alone. We'll look at how we can tailor a very specific care plan. So it's not a one-size-fits-all, but based upon your examination findings, and already covers this in great detail in day one. We're going to take that in a different direction when it comes to neurological, a functional neurological aspect, and we're going to see how we can put together a very tailored exercise plan that's specific to the patient and ensuring that we don't exceed what that patient can handle as well. And we'll talk about some of these windows of autonomic function. And finally, Ulrich and I will get on stage and we'll talk about how we can integrate both days 1 and days 2 into the patient that presents on Monday morning. We've had some feedback from patients, from attendees from our Oslo seminar, and they've said on day 1, on Monday or Tuesday, 1 or 2 days after the seminar, this patient presented in their office, and based upon the information that we were very fortunate to share with them. They've been able to identify and manage that patient in an enhanced way. So we're chuffed to hear that. So finally, the details can be found at www.brainhubacademia.com.au. You can find information about the seminar, what we're presenting, as well as registration details. Now, early bird closes August 31. I can tell you now that we're very likely to sell out before that date. We've already sold a handful of tickets and will continue to do so. If Ulrich's track record of selling out events before early bird is any sign, then no doubt, hopefully the combination of both he and I will have a great list of attendees from a spectrum of practices and experience. So be sure to join Ulrich and I's October 6 and 7 in London. Bye for now.